Hello. Today we will be discussing separation anxiety disorder. According to the DSM-5, separation anxiety disorder is defined as having developmentally inappropriate and excessive fear or anxiety concerning separation from those to whom the individual is attached. The two key words here are inappropriate and excessive. We all experience anxiety. It's a very human emotion, natural emotion. We may experience anxiety in anticipation of giving a public speech or taking a test that we're not quite prepared for. However, individuals experiencing this disturbance, their anxiety is like 10 times stronger. And it could be inappropriate depending on the age of the individual experiencing the disturbance. For instance, it would be quite abnormal to witness a 40-year-old adult experiencing anxiety in anticipation of separation from their parents or a significant other. Now, the DSM-5 gives 8 symptoms, and you must have at least 3 out of these symptoms to receive this diagnosis. One is having recurrent excessive distress when anticipating or experiencing separation. 2, persistent and excessive worry about losing a major attachment figure. 3, persistent and excessive worry about experiencing maybe an event that would cause you to be separated from your attachment figure. 4, persistence or reluctance to go away from home because of fear of separation. You could have persistent and excessive fear about being alone, period. Persistence and reluctance to sleep away from home or to go to sleep without having your major attachment figure near. You could have repeated nightmares involving the theme of separation. And you could also have repeated complaints of physical symptoms when anticipating separation or being separated from the major attachment figure. Now, the DSM-5 gives 3 additional diagnostic criteria. One is the anxiety persists for at least 4 months in children and 6 months in adults. The disturbance must cause significant distress and impairment, socially, occupationally, or academically. And the disturbance is not better explained by another mental diagnosis. The prevalence for this disorder is 4% in children between the ages of 6 and 12, 1.6% in adolescents, and 0.9% to 1.9% in adults. There are differential diagnoses. These are diagnoses that may have symptoms in common with separation anxiety disorder, but they are not separation anxiety disorder. So the DSM-5 gives 12. There is generalized anxiety disorder. These are individuals who have anxiety over pretty much anything. There are panic disorders. People experiencing separation anxiety may panic, but their panic is not caused by anything else except the anticipation of the separation. There are individuals with agoraphobia. These are people who are afraid of being closed in, locked in somewhere where they're unable to escape. Individuals with separation anxiety disorder, their fear is not being locked in. Their fear is being locked away from their major attachment figure. There are conduct disorders. This is more prevalent in children. And indeed, children with separation anxiety disorder may act out, but it is due specifically because of the separation and not anything else. There are individuals with social anxiety disorder. These are individuals who are afraid of being judged or criticized in social settings. Individuals with separation anxiety disorder are afraid of nothing but the separation. There's post-traumatic stress disorders. These are individuals who are traumatized, and they indeed have certain symptoms similar to separation anxiety disorder. So, for instance, the nightmares. However, again, the separation, the nightmares, the trauma in PTSD is the cause of those symptoms, and separation is the cause of the anxiety in individuals with the separation anxiety disorder. There's illness anxiety disorders. These are individuals who are constantly afraid of that they anticipate that they will be getting sick or gravely ill. Individuals with separation anxiety disorder do sometimes complain of physical symptoms. However, it is due specifically because of the separation. There are individuals with bereavement disorders. These are individuals who cannot stop grieving over the death of a loved one or a significant other. People with separation anxiety disorder, they grieve specifically over the separation, and usually that bereavement dissipates once the separation ends. There are individuals with depressive and bipolar disorders. Indeed, anticipating separation from a major attachment figure would cause the individual to be depressed, but it is triggered specifically by the separation and not anything else. There are children specifically with oppositional defiant disorders. These are children who act out for any reason. Children with separation anxiety disorder will act out specifically because of the separation that they're trying to prevent. There are psychotic disorders. Individuals with separation anxiety disorder may have a distorted view of the anticipated separation and what it may cause in their lives, but that view leaves once the separation ends. And individuals with psychotic disorders, their psychotic disorder is due more so biologically than brought on by an event. Personality disorders, these are individuals who may be dependent on others. Children and adults with separation anxiety disorder aren't dependent on anyone. They are simply afraid of the separation. Now, there are several diagnoses that are comorbid with separation anxiety disorder. For instance, with children, they may have this disorder and also have it accompanied by having a generalized anxiety disorder or a specific phobia. In adults, the list is a little longer. You could have an adult with separation anxiety disorder and also PTSD or panic disorder or social anxiety disorder, agoraphobia, generalized anxiety disorder, obsessive compulsive disorder, personality disorder, specific phobia, or depressive and bipolar disorders. But as stated before, these disorders are distinctly different from separation anxiety disorder. Now, treatment for separation anxiety disorder in adults and children usually is cognitive behavioral therapy, which focuses on recognizing the anxious feelings, the thoughts, and physical responses. They will be taught to relax, and they will be subjected to systematic desensitization. For children, though, the therapy, it looks a little different. It may include modeling and role play, and parents are generally encouraged to get involved. Again, there are also support groups, and antidepressant medication may also be given. For very young children, though, however, play therapy is used, and toys and puppets and games and art are utilized to help the children express feelings and understand the reasons behind them. And then they are given an opportunity to learn alternate ways of coping with emotions. So in conclusion, separation anxiety disorder is more prevalent in children between the ages of 6 and 12 than any other population. It is natural for a child between the ages of 6 months and 3 years to experience separation anxiety, but it wouldn't necessarily be diagnosed as a disorder. However, for adults, for older children and adults to be diagnosed, the symptoms must persist for at least 4 months consecutively. This disorder is persistent, overwhelming, and causes great distress and dysfunction in the individuals experiencing it. This disorder is often accompanied by other disorders that exacerbate the distress. However, the good news is that separation anxiety disorder has a high treatment success rate in both adults and children. And so that concludes my presentation. And some final words is that indeed, dogs also experience separation anxiety when anticipating separation from their masters. So I hope you enjoyed my presentation. Thank you.